Okay, I think I'm gonna get started and then people can just join as we go along. So, assalamu alaikum, everyone. Thank you so much for joining today. I hope you find this useful. My name is Dr. Fatima Kapasi, or Fatima Girnari, as I'm known in Masjid, and I'm a family physician in Brampton. So, I'm going to talk to you today about cancer screening. The reason that I wanted to talk about this topic is I think it's very important. And the main issue is that cancer is one of the top four causes of death in Canada as well as worldwide for both men and women. And so it's very common, and there is screening available, which increases our chances of finding it early and treating it before it actually becomes a problem. So there are things we can do about it. The problem is that within our community, so the South Asian community, the uptake of people taking on or doing cancer screening is very low. And often it's because people think, well, it's not in my family, I'm feeling well, and it's not going to affect me. And so because of that, people don't get their screening done. So I'm hoping that at the end of today, at least all of you that are on this talk, if you haven't got your cancer screening already, you'll at least consider getting it, even if you don't get it going forward, but at least think about it and know what's available out there. Okay. So let's go over what we'll discuss today. So we're going to discuss the three main cancers that we screen for are for women: cervical cancer, breast cancer, and colorectal or bowel cancer. We'll discuss some of the risk factors of these cancers and also things that we can do to prevent them or things that kind of make us more prone um, to getting these cancers. Okay, so what is cancer screening? So screening is testing that we do on people who are healthy. So not if you have any cancer symptoms, not if you just have a family history, on anyone who is healthy and has no symptoms. And the point of it is to identify abnormal cells so that they can be treated, or abnormal signs that can be treated before it becomes cancer that gives you symptoms and eventually can potentially spread and cause death. As I said, the goal is to detect abnormalities and treat it. And there are three cancers in women that are routinely done, which means all women, if you fall in that age group, you will be eligible for these three cancers. And in Canada, these are covered, so it doesn't cost you anything as long as you have a health card here. It is usually covered in other countries too, including the UK, and it is available in countries even where it's not covered, such as the US. So the three cancers are cervical, breast, and colorectal, as I mentioned. So I'm going to start with cervical cancer. And the reason for that is because we start screening younger in cervical cancer. So as I'd said in the message that we send around, it actually affects younger people from 25 onwards. So I'm just going to talk a little bit about what the cervix is initially. So this picture is of the uterus. So I'm hoping you can see my arrow. Let me know if you can't. But essentially, this main triangular shaped structure is the uterus. The cervix is the opening or the gate into the uterus, and that part usually gets cancer younger. Okay, so that's what we're trying to prevent with screening for cancer of the cervix or cervical cancer screening. Now, the aim, again, even with cervical cancer screening, is to find cells that are abnormal. So cells that shouldn't be there and to remove them before they become cancer. Not all abnormal cells mean that they're cancer. So if you do your cancer screening and it shows abnormal cells, it doesn't mean you have cancer. So it doesn't necessarily mean that it's something to worry about, okay? But the aim is to find abnormal cells and then do something about it. Okay. HPV is the human papilloma virus, and that is the most commonly responsible virus that causes cancer of the cervix. It is usually people get it through sexual intercourse or any sexual contact with another person. Okay, so it's considered a sexually transmitted infection, which means you get it through sexual contact. When you get HPV, those cells in the cervix that I showed you go through changes and become abnormal. Now, most of us healthy individuals, your body will fight those cells and the changes will go back to normal within 1 year. If they don't and they stay abnormal over quite a few years, so usually close to 10 to 15 years, it then can become cancer. So that's when the risk is high. So if you have HPV even now, it might not cause any problem. So initially, it can be okay just to monitor it. But over time, it can become cancer. And the aim is to pick it up early so we can actually treat it before it goes to that stage. There are about 200 different types or strains of HPV, and some of those are more high risk. For example, HPV 16 and 18, they cause about 70% of the cervical cancer. So those are the ones we're really trying to target. Okay, it doesn't mean that all of them will be a problem, and there's no test that actually tests for every single one. Now, it doesn't only cause cancer. HPV can also cause warts. And some of you might have them and not even be aware that you have them. They're basically little lumps that you can get in the skin around your private areas, around your anus. And they can sometimes feel a little bit rough to touch. Sometimes it feels, or it's described as a cauliflower. It can feel like that. And sometimes they can just be too small for you to even know what the shape of it is. They can be annoying, but they're not cancerous. And there are treatments for it, but the treatments don't necessarily get rid of it. They can come back again, but there are treatments. So if they're bothering you, you can speak to your family physician and they can treat them. Okay, they can also affect men, but obviously men don't have a cervix, so they can't get cervical cancer, but they can get the warts the same way that women can get them, and they're also treatable, but they're not cancerous for men. So, in terms of cervical cancer screening, who is the screening for? Anyone from the age of 25 to 74 who has ever had sexual intercourse. If you're 21 and over, but you have a condition where your immunity is low, then you can actually start screening at the moment from the age of 21. But generally, for any regular person who's otherwise healthy, the screening starts in Ontario or in Canada from 25 to 74, and it's done every 3 years. The only people who don't need to get screened are under 25s who are healthy, people who have had surgery where they've had their entire uterus removed for whatever reason. However, even for those people, it's called a hysterectomy, but you do need to find out whether your cervix was also removed during the hysterectomy, because if it wasn't, then you should be getting screening as well. And the other group of people is those who have never had sexual intercourse before. In terms of the what we do at the moment, or the current guidance in Ontario, is something called a pap smear. As I said, it starts from 25 and it's every 3 years, and it can go up to 70 if you've been having them regularly. Otherwise, it can be done even up to the age of 74. So what's the process? So it usually takes a few minutes. You just book it with your family physician or gynecologist. They get you to lie flat on your back with your knees bent. And then they insert a tube, which is usually plastic or metal, into your the genital area and push it all the way through to your cervix. So if you imagine, it can be a little bit uncomfortable, but it shouldn't be too painful that you can't tolerate it. They then have a look at your cervix to see if there's any changes in the cells or any obvious abnormalities, and then use a brush to take a sample of cells. Those cells are then sent to the lab, and they look at them to see if they are the typical cells that you normally find in the cervix or they're abnormal. And then depending on the abnormality, you either would get screening, um, you either would get screening more frequently, or they would offer you to get HPV testing to see if you're positive. Because if you don't have HPV, then it's nothing to worry about. If you do, then it depends on the types. At the moment, HPV testing is not covered, so it's an additional cost. So people who don't want to pay, you can just get your next pap test within a year, instead of waiting the full 3 years if there are any changes seen. If they see changes that are highly likely to be cancerous, then it's treated straight away. Okay. Now, this process is going to actually change in Ontario in less than a week. So on the 3rd of March, the guidance is changing. So instead of doing pap smears as they are by collecting the cells, we're going to just be testing directly for HPV and particularly the high risk types. So it will be much better, it's more accurate, and you only need to get it done every 5 years instead of every 3 years now. And this test is going to be starting from 25 years of age for everyone, even if your immunity is low. Okay, so if you haven't had it done yet, just wait another week until the 23rd and then book it to get it done then so that you're on the newer system of screening. Okay, so in terms of risk factors, so things that increase your chances of getting cervical cancer, and again, you can get cervical cancer without any of these risk factors too. But things that increase your chances are if you have a weakened immune system. So if you have any condition that reduces your immunity, because then your body is less likely to fight those changes that have already been caused, you are at slightly increased risk. If you've had multiple pregnancies that have been normal deliveries. So vaginal deliveries, you have more of a risk compared to someone who's had multiple cesarean sections. If you've ever had a sexually transmitted infection in the past, again, you're at higher risk, or if you've been using birth control for more than 5 years. However, with that risk, it does reverse once you stop birth control. If you're a smoker, that also increases your risk. And if you've had more than one sexual partner for whatever reason and at any point in your life, that also increases your risk further. The good thing about cervical cancer and the reason that the rates of cervical cancer have dropped compared to the others, it's not one of the highest risk ones at the moment, is because there is a vaccination available. Kids at school at the moment do get it already, both boys and girls, between the ages of 9 and 14. But if you do fall into that age group where you didn't get the vaccine, you can get it. It's most effective if you get it before you've ever had sexual intercourse, so you're protected from the start. But even after you've had intercourse the first time, you can still get the vaccine. It's 3 doses, and usually your family doctor can give you a prescription for it and they can administer the vaccines for you. The thing to note though is if you already have HPV, it won't treat any previous ones that you've had. Okay. Um, as I said, it's approved in Canada even after you've gone past the age of 14, but for women up to 46, for men up to 26 years old. So if you're in that age group and you know that you haven't had it, it is a good idea to get it because it is very effective. Now that was screening of cervical cancer for people who have no symptoms. If you have any symptoms that I'm going to go through now, and you have had your pap tests or cervical cancer screening and it's up to date, even if all your tests have been normal, if you get any of these symptoms, you still need to see your doctor, okay? Because the screening test is not 100%. So if you've had a screening test within the past 3 years, it's not that you won't get cancer. It just increases the chances that we will pick it up early. So if you get symptoms, you still need to be seen. Particularly things that we worry about are unusual vaginal bleeding. So that means any bleeding outside of your regular period. So your periods should be from 1 month to the next, right? So if you get bleeding in between that time, that is considered unusual vaginal bleeding and is not normal. If you're getting a lot of discharge from the vaginal area, from the private area, and that's not normal for you, then that's a cause for concern. People often ask me, what's normal in terms of how much discharge they have, and everyone is different. So each person will have a different amount of discharge depending on their normal body type. And if there's a change from your normal, that's what you need to report. If you're getting any smell in that discharge that's been going on for a while, that's something to report too. If after doing an examination, so a pelvic exam in your clinic, every time your doctor does an exam, you're bleeding very easily, that's also not normal. Again, when you're having intercourse, if you're getting any bleeding, that's never normal, so it needs to be seen. The next symptoms, so back pain, leg pain, pelvic pain, weight loss, tiredness, or fatigue, those are all common things that happen with lots of other issues, but it is worth thinking about because they can be the symptoms that happen when you have cancer of the cervix too. And the other thing is pain or discomfort when you're trying to pee or when you're trying to pass urine, or you're noticing that you're kind of losing control of your bladder and you're having lots of accidents. That's something as well, just to talk to your doctor about. None of these mean that you have cancer, but they're things that we should think about. Okay. I'm going to move on now to breast cancer. Breast cancer is one of the four most common cancers
Meeting.
that we get
Webinar.
in Canada and worldwide. So, I'm going to go through the risk factors first because breast cancer can happen to anyone. So even if you have no family history of breast cancer, you don't have anyone for generations that has had breast cancer, you can still have it. So it is important to get screening, and it is covered. It is easy. So please consider it. The general screening, the age used to be 50 to 69 because that is the highest age group and it's where it's most common. So if you're in that age group, certainly be thinking about it, but we'll talk about the other age groups now as well. Um, as we all know, breast cancer actually does affect women a lot more than men. And when men get breast cancer, it tends to be a lot more aggressive too. So if you have a male family member that has breast cancer, it's worth talking to your doctor about it. Okay. The reason for that,
Hi everyone. Sorry, could everyone please mute yourselves because we can hear feedback. Thank you.
thank you. Yeah, so the reason women get breast cancer more than men is because of the fact that we have hormones called estrogen, which usually is produced more from the time that we get our first period to the time we get our last one. So menarche is the first period and menopause is your last, is a year after your last. So in that time, you're more at risk of getting breast cancer too. And so if you've had your first period when you're very young, or you go into menopause very late, you're at higher risk too. If you have children very late, that can also cause increase your risk a little bit, or if you've never had children, because during the time that you're pregnant, because of the changes in your estrogen, you're not getting regular cycles, that reduces the time that you are exposed to that estrogen, which increases your risk, right? So the more pregnancies you have, the less your risk, theoretically. If you've ever had cancer, breast cancer, you can get it again. So that automatically increases your risk. And if you have a family history of breast cancer, your risk is higher too. And it actually increases by double if you have a mom, a sister, or a child that has had breast cancer. Okay. There are some genes in our DNA that increase our risk quite a lot of breast cancer. Uh, you might have heard of BRCA1 and 2, and there are changes that happen to these genes that can cause you or cause cancer cells to grow. So if you have a very strong history in your family, so multiple members in your family who've had breast cancer, they usually do go through genetic testing for you to see whether you actually have those genes. And if you do, then sometimes people even get their breasts removed if their risk is high. So that's definitely something to speak to your doctor about if you have lots of family members that are close. So first degree relatives, which is your parents, your siblings, or your children who have breast cancer. Okay. Dense breasts. Now that basically you'll only know if you've had a mammogram. So when they do your mammogram, they will comment on how dense your breasts are. That is talking about the tissue. So fatty tissue is not dense. The other things that make up your breast, so things like the milk ducts, and the other tissue or fibrous tissue in there is what makes your breasts dense. The more dense they are, the harder it is to see any small lumps. And so because of that, that increases your risks only because they might not pick up small cancers or small lumps. And we'll talk about what we do about that later as well. If you've ever had radiation therapy because of a different cancer, again, you're at higher risk. If you have had a hormone replacement therapy, certain types of it can increase your risk of breast cancer if you've been using it for more than 5 years, although it's not a big risk. It is a risk. Same with combined contraceptives or birth control. And this is a really big one, but if you're not active, if you're not doing any physical activity, or if you're obese, which means that your weight is you're heavy beyond a certain point. So I'm going to talk about your BMI, which is your basal metabolic index, which is how we compare one person's weight to another. Because if you're tall and you weigh, say, 100 kilos, and there's another person who's short and they weigh 100 kilos, the shorter person is more at risk, right? Because the taller you are, the more you're allowed to be a little bit heavier, and your BMI will still be within the normal range. So it's easy to calculate. And if you don't know your BMI, it's a good idea to calculate it. All you need is your height and your weight, and you can put it on a BMI calculator online and find out what your BMI is. A healthy BMI is between 20 and 25. 25 to 30 is considered overweight, and 30 and above is obese. And obesity is what increases your risk of cancer quite a lot, by 2.5 times compared to someone in the healthy BMI range. Okay, so that's definitely important to consider. This chart is actually from the British Menopause Society website, and it just is a good indication of the risk of breast cancer compared to some of the different risk factors. And I just mainly really wanted to focus on the one about your BMI. So the background risk, the one that says 23, that is looking at about 1,000 women between the age of 50 and 59. And so,
Hello, everyone. Sorry, could you please mute yourself? There is a lot of feedback.
okay. Um, Yeah, sorry. So where was that? Yeah, the point of this is just to see how having a BMI of more than 30 is actually a really, really big risk factor compared to anything else. People usually worry about taking hormones or other things, but actually weight loss is a really, really big one. So if you have no risk factors or no beneficial factors in the age group of 50 to 59, they found that 23 women out of the 1,000 had a risk and got breast cancer. Out of those, the ones that regularly exercised had a reduced risk compared to the average risk, but the ones that had a weight or a BMI of more than 30 had more than double the risk of the average person who didn't have any other risk factors. So if there's anything that you take home today, other than the fact that you should be getting your cancer screening done, it's if you're not active, start getting active and work on weight loss. And there's lots of things that can be done for that. Okay, so let's talk about the screening recommendation. So at the moment in Ontario, the routine screening for everyone is a mammogram. A mammogram is an X-ray or a series of X-rays that are passed through the breast to try and pick up any abnormalities or any lumps. It's usually done every 2 years. And if you've had anyone have a mammogram or you've had it before, people often complain that they don't want to do it because it's painful. And yes, it can be a bit painful because of the process of how they have to do it. So I'll just briefly explain what they do, but they put a plate underneath your breast that they're testing, and then another one goes on top of it. And it presses your breast down so that they can pass the x-rays through and try and pick up as many abnormalities as possible. If it is really painful and you can't tolerate it, speak to your doctor. There might be things that can be done about it, even if it's just taking painkillers before, but don't let that be the reason you don't do it. Um, there are different age groups that you can get screening for. And again, if you feel like you're in the high risk group, speak to your doctor. I'm just going to briefly talk about it so that if that's something that's really concerning you, because I get asked about it a lot, at least you know where you might fall. So generally, from the age of 30 to 69, you can get screening with both a mammogram every year and an MRI of your breasts every year if you're considered very high risk for breast cancer. And the four conditions of that are either you have one of those high risk genes that I mentioned earlier, so BRCA1 and 2, and then there's other gene mutations or changes that you can have that increase your risk. So if you have any of those, you would be eligible for the high risk screening. The other is if you have a first degree relative, so your mom, your sister or your child or even your brother who has the gene, but you've chosen not to get tested because you don't want to know if you have it, you can still get high risk screening. If you've been seen in a genetics clinic and they've assessed your history, so your all your medical conditions, the medication you take, and your family history, and they think that you're high risk, that also can be a reason they can refer you for it. Or if you've had other cancers, and so you've had radiation therapy to your chest or to yeah, so before the age of 30, if you've had any kind of radiation, or at least 6 years before. So prior to so if you've had it basically at the age of 24, 6 to 8 years before, I believe it is, and then you can go for the high risk screening, and you can get referred for that quite easily by your doctor. The guidance has changed fairly recently as well, that now anyone from the age of 40 to 49 can also get routine mammograms, and this is anyone who has a low risk or no family history of cancer. The only condition is that you talk to your doctor about it first, because in this age group, although they do pick up cancers early, there are also lots of other lumps you can have that may not be cancers. But if they pick it up, you might end up going through getting a biopsy and further testing, which can also cause a lot of stress, right? As soon as someone tells you, we've seen a lump on your mammogram, you need a biopsy, that's going to create a lot of stress. And this can happen more so in this age group compared to in another age group, right? So it's important to be aware that that might happen. But we do pick up cancers in that age group, and it is still covered. It's still free even within this age group. The general age where we do mammograms is between the age of 50 and 74. So it's done every 2 years for most people. And there's the most benefit of doing screening in this age, because we know that it affects most people in that age group too. If you have certain conditions, you don't get a mammogram every 2 years, you would get it every year instead. Some of those conditions are if you have ever had ovarian cancer before, because it increases your risk of breast cancer. If you have two or more family members who have had breast cancer, but they don't have that gene, then you would just get it once a year. And if they were both under the age of 50, or if you've had any male relative, so any male relative who has had breast cancer, then you also would get it every year instead. Um, and then I mentioned earlier about breast density. So if you have a high breast density, which would have been picked up on a previous mammogram, then you would have it every year. And the reason, as I said before, was because you might not easily see them on the mammogram. So if you're doing it more frequently, you're more likely to pick it up as it's growing before it's grown too much. Okay. Or the other condition is if when you go for your mammogram, the radiologist decides that they want to repeat it in a year, they'll let you know. Okay, so generally the guidance tends to be you can get it from 40 to 74 years, and it's usually every 2 years. Between 40 and 49 years, it's better to discuss the risks and benefits with your family doctor, but if you feel like you want it, you can definitely have it. Okay, now if you have any symptoms of breast cancer, and we'll talk about those, then it's important not to just go for a screening mammogram. You should talk to your doctor about it, because there are two types of mammograms, a screening one and a diagnostic one. The diagnostic one is longer, and they look at it more detail, and there's more radiation exposure. So if you have any symptoms and they're worried about looking for a lump, then they would send you for a diagnostic test. Um, as I mentioned, there are some disadvantages sometimes to screening, because many times we pick up lumps that are not necessarily cancer, but you might end up having to go through a biopsy just to make sure, or you might go through frequent scans just to make sure that it's not growing and it's nothing to worry about. And the other thing is, occasionally we might pick up a cancer that wouldn't have caused any problems for you. It was probably one that is very, very slow growing, and even if you left it alone, it wouldn't do anything. Again, considering the risk and benefit, it's still considered better to get screening even with this in mind, because it's not often that we pick these versus a cancer that we need to treat. Okay, if you do get screening early, it's easier to treat. The treatment tends to be shorter, and it has a much higher chance of working, and reduces the risk of spread. So if you've had all your mammograms, you're getting it done every 2 years from the time you turn 40, and then you notice that you have any of these symptoms, it doesn't matter. If you have symptoms, you need to still see your doctor because a mammogram can miss a breast cancer lump as well. Okay, so things you're looking for is any lump, it's worth getting checked out by your doctor. Anything that doesn't feel normal for you. Sometimes during your periods, you might notice that your breasts feel lumpy, and then after your periods, it becomes normal again. That's quite common. You're looking for a lump that stays there even through your periods and once you're done. Okay. If you have a lump in your armpit as well, because your breast actually extends all the way into your armpit, so that's still part of your breast tissue. So even a lump in your armpit, it's worth seeing your doctor. There are lots of reasons you can have lumps in your armpits because there are lots of other things there, like lymph nodes, which do swell up quite easily, but it's still worth discussing it with them. I've written dimpling of the skin of the breast here. And what I mean by that is if you imagine an orange, right? So the peel of an orange has like little holes on it. That's called dimpling. If you see that on your skin, on your breast skin, that can potentially be another sign. So that's also worth seeing your doctor about. Unless it just goes away on its own, then you don't have to worry. But anything that's staying there, not going away, needs to be seen. If you have any changes to your nipple, so instead of pointing outwards, if it's pointing inwards, and this is something that's not new, so that's new, it's not been there from as long as you know, then that needs to be seen. Or if you're bleeding from your nipples or you're getting any discharge and you're not breastfeeding, that needs to be something that's seen. Okay. And the last one is skin changes. So you can get a rash, which looks like eczema on the skin of your breast. If it's not getting better with treatment, it needs to be seen because you can get just skin changes, and that could be cancer too. Okay, so that's breast cancer in a nutshell. I'm sorry, I know it's a lot of information. So if you do have any questions, please feel free to type them in the chat box or just say it out at the end, and I'll be able to go over them. Okay, I'm going to just go over colorectal cancer as well. Okay, so this is the third cancer that I'm going to talk about. It's the final one, but it's also one of the most common ones alongside breast cancer in both male and female. The I'll tell you, let's talk about the anatomy first, actually. So your digestive system is made of the small and the large intestine. So if you look at this picture, it's not great. It's not an accurate picture, obviously, but this part, the inside is the small intestine, and that's where all your food gets digested. And then this is your large intestine, your colon, and that's your rectum, and then that's your anus. So that's the part where you poo from. Okay, so this is the part we're interested in colon, in as the colon. Okay, so that's the part we're worried about in terms of a cancer risk. There are lots of risk factors. Your age. So as you get older, your risk of colon cancer increases. If you're not physically active, again, as the same with all the other cancers too, that increases your risk. If you have had cancer before or colorectal cancer before, you can get it again. With this one, unlike with breast cancer, men get it more commonly than women, though we do get a lot of women with it too. Overweight or obesity. So overweight, remember, is the BMI between 25 and 30, and obesity is a BMI of 30 and above. That increases your risk. If you have a family history of colon cancer, you're also at risk. If you have inflammatory bowel disease, so things like Crohn's disease that affects your large intestine or your colon, or if you have ulcerative colitis, that can increase your risk too. And polyps. So polyps are little growths that you can get in your all along your bowel. And many people often have them, and it doesn't mean that it's cancerous, but generally when it's picked up on a colonoscopy, they tend to take it, the doctor who's doing the endoscopy or the colonoscopy will take it out there and then because they can become cancerous. And there are certain conditions where you get multiple polyps, such as I've written them here, but it's familial adenomatous polyposis and Lynch syndrome. Those are the two conditions that cause you to have multiple polyps, like hundreds of them. And so because of that, they can't obviously go in and remove all of them. So we need to screen you more frequently because you're at higher risk. So what does the colorectal cancer screening involve? So it starts at the age of 50 and goes on to 74. And it's in Ontario, it's done every 2 years. It is done for people with no symptoms. So it's for screening of people, like everyday people who are otherwise healthy. If you have a first degree relative, so a parent, a sibling, or a child with colorectal cancer, you can't have you're not considered average risk, okay? This is just for average risk people, so people who don't have a family history or personal history. If you have any of the conditions that make you high risk, as I mentioned on the last page, again, you wouldn't be considered average risk, so you would have a different pathway, and I'll talk about that later. So this is for people who don't have any of that. You don't have any polyps, you don't have any personal or family history, you don't have uh, yeah, you don't have any symptoms. Okay. The two options for screening are usually either a fit test, which is basically a stool test. So your doctor will send a requisition to the lab, and then they will send you a kit at home. In that kit, you just need to submit a sample of your poo and send it to the lab. They give you everything, the envelope that you need to put it in, and you just send it to the lab every 2 years. And it's looking for any blood, microscopic blood in the poo. If it does pick it up, then you need to go on to get a colonoscopy, which is a camera test that looks at your whole colon, so the whole large intestine. If you don't want to get that done every 2 years, the other option is to get something called a flexible sigmoidoscopy, which is a flexible tube, a bendable tube that has a light attached to it, and it goes in. It's not the same as a colonoscopy because it's much shorter. It just covers a small section, so the highest risk section of your colon, and it has a look at it to see if it's got any polyps or any signs of any growth or cancers. And if you get that done, then you only need it every 10 years. Again, if there's abnormalities noted on that, then the person who's doing the test will let you know and you'll get screening done more frequently. Anyone with any abnormal result needs something called a colonoscopy. Okay? So now in the increased risk group, so if you have one or more first degree relatives who have had cancer, then you need to get a colonoscopy done from the time you turn 50 or 10 years before the youngest relative was diagnosed. So for example, if you have um, five people in your family that are first degree relatives, so your parents, your siblings, or your children that had colon cancer, you look at the one who was youngest when they were diagnosed. So say your brother was 30 when he was diagnosed, then your colonoscopy would start at the age of 20. So 10 years before the youngest relative. And if the youngest one was 70, then you would start at 50. Okay, so I hope that makes sense. And then how often you have it after that depends on what they see on your colonoscopy. So if you have polyps or if you have other things, they might actually do it every 5 years. If you have nothing, they might actually say you can come back in 10 years. Okay. If you have symptoms of cancer of the colon or colorectal cancer, then you need to be referred for colonoscopy straight away. Okay, so it doesn't matter um, whether or not you've had your stool screening or anything like that, you need to be seen by a specialist, and they usually will do a colonoscopy in the first instant to make sure that it's not bowel cancer. But even if your colonoscopy is normal, it still needs to be investigated as to why you have those symptoms. Okay. So in terms of signs and symptoms, things you're looking for are a change in your bowel habit. So that means if you normally are someone who tends to be constipated, so your poo is usually hard, you might poo maybe once every, 2 or 3 days, and that's normal for you. That's how it's been for years. All of a sudden, over the past 3 months, you've noticed that your poo is more runny, you're getting more diarrhea like poo or more softer poo, and you're getting it more frequently. That's considered a change in your routine, in your usual bowel habit. So that needs to be looked at. If you're getting tired all the time, that is a very, very common symptom of lots of different medical problems, but one of them could be bowel cancer. So it's important to think about it at least. If you're getting weight loss, again, a very common symptom also brought up in all of the three cancers I talked about today, but again, we need to think about bowel cancer too. If you're getting cramping or pain in the stomach and or in the abdominal area, that doesn't mean that, if you have had pain for 2 weeks, it's cancer. Usually it's pain that's been going on for a long time and there's no other cause found for it. Then we need to think about this. If you have blood in your stool, again, there's lots of possible reasons for why you have it, but if you're in this high risk group, so from the age of 50 to 69, bowel cancer definitely has to be one of the things that your doctor tries to rule out. Okay, and lastly, it's iron deficiency anemia. Now, that's one of the most common things that I see people with, and very infrequently is it because of bowel cancer. But it is something, it's not a diagnosis. So you can't it's not like saying I have diabetes or I have high blood pressure. Iron deficiency anemia is not a disease, it's actually a symptom. So there's always something that's causing it. In most cases, it might be your diet. You might not be taking enough iron or it could be something as simple as that. But bowel cancer is another cause for why you have it. So if you have iron deficiency anemia and you've been taking iron supplements, you're replacing your iron, and it's still not improving, you do need to have an endoscopy and a colonoscopy to make sure that there isn't any signs of any bowel cancer anywhere or any cancer up in your food pipe to make sure that that's not causing the anemia. Okay, so don't ignore it. If you have anemia, make sure you know why you have it or your doctor has looked into why you have it. Okay. Okay, so in summary, cervical cancer is usually is commonly caused by HPV, and there is a vaccine that's available to reduce your risk. The screening starts from 25 to 70, usually 74, unless you've been having regular screening when you can stop it at 70. And now it's going to be done every 5 years instead. Breast cancer screening starts from 40 to 74, and it's usually a mammogram, which most people get it every 2 years, unless you're in the other groups that I discussed. And colorectal cancer starts from 50 to 74, and it's either every 2 years if you're having a stool test done or the FIT test, or every 10 years if you're having the flexible sigmoidoscopy or the camera exam. Okay? So I know that was a lot of information. So if there's anything that's not clear, I'm happy for you to approach me or to ask questions right now. I'm happy to answer them. There is also a feedback form if you just want to take a picture of it and you can send us your feedback. We've had some great feedback and we're working on um, trying to address some of the issues or things that have been noted on there. Okay, so we are going to take it seriously. So please, if you have any feedback, feel free to let us know. We're looking at it constantly. And I hope you found this useful. If you have any questions, I'll be hanging around for a while. So please feel free. If you don't want to, I think there should be a chat box on here. And I'm going to turn off the recording so that you can feel free to ask.